Hi, my name is Ashley Gallegos, and today I'm going to be explaining how to give proper female perineal care. So the first thing that you want to do is knock before entering. Then when you have entered your patient's room, if they have any visitors, you are just going to politely ask them to wait outside until you are done performing this procedure. Then you are going to identify your patient. And then you are going to identify yourself with your name and your job title. Then throughout and before this procedure, you are to explain the steps that you are doing to your patient. And also throughout this procedure, you are to protect your patient's rights as well as being gentle with them. So the first thing that you want to do is wash your hands. Then you are going to gather all of your supplies. So the supplies that I'm going to need today are a towel as well as a bath towel, a waterproof underpad, soap, paper towels, a laundry bag, washcloths. Typically you'll need about 4, but you may need more, gloves, and then a wash basin as well as a thermometer. So after you have gathered all your supplies, you are just going to wash your hands again, and then you are going to apply your gloves. Then you are going to identify your patient using 2 identifiers, and then you are just going to provide for privacy. So just close any curtains, shut the door, anything like that. Then you are just going to raise the bed for good body mechanics and just make sure that the bed wheels are locked. And if your patient uses bed rails, you are just going to lower the bed rail that is near you on your side. Also, when you get all your supplies together, just make sure that you apply paper towels on the over bed table, and then you could put your supplies on top of the paper towels. Then you can position the over bed table within your reach towards the bed, and then you are just going to so after that you can fill the wash basin up, and typically the water should be 105 to 109 degrees. Just make sure you look at your patient's care plan, because it could say the temperature that they usually have their water at, and you could use your thermometer to make sure that the temperature for the water is correct. And then also, when you have filled up the water in your wash basin, just ask your patient if the water temperature is not too hot or anything like that. And then you are going to position your patient on her back, and then you are going to put the bath blanket over your patient. You are going to drape it, and the bath blanket is going to be like a diamond position. And then you are just going to remove the top linens towards the foot of the bed. And then after that, you are going to have your patient separate her legs and flex her knees. And if she isn't able to flex her knees, you're just going to help her separate her legs. And then you are going to apply the waterproof underpad underneath her buttocks. And then after that, you are just going to remove your gloves and wash your hands, and then put on clean new gloves. And then after that, you are going to take a clean washcloth, and you are just going to make it wet in the wash basin, and then you are going to add your soap, and then you are going to be cleaning the vaginal area, the perineal area. So you are going to first separate the labia, and then you are just going to clean one side of the labia. So you are going to do downward strokes and make sure you are cleaning from front to back. And Just make sure you are using, with every stroke, you are using a different clean portion of the washcloth. And then you are going to be cleaning the other side of the labia. So just make sure, same thing, downward strokes from front to back, and that you are using clean different portions of the washcloth. Then you could get a new washcloth and you can wet it again and apply soap. Then you're going to be cleaning the vaginal area, so clean from front to back with downward strokes. And then after you have cleaned these areas, you are going to rinse them now with clean washcloths. So you are just going to make sure you mitt the washcloth, and then just get the washcloth wet. And then you are going to separate the labia and just rinse one side of the labia with downward strokes from front to back. And then after you have done that side, you could do the other side of the labia, the same thing, downward strokes from front to back. And then you are going to clean the vaginal area, same thing, front to back with downward strokes, and make sure you are using clean portions of the washcloth. And you could always get a new washcloth if you have if the washcloth is dirty. And if it is dirty, just place this washcloth in the laundry bag. And so after you have rinsed all of that, now you are going to position your patient on her side facing away from you. And now we are going to be cleaning the, hold on. So before you position her on her side, you are just going to take the towel and you are going to dry the perineal area. So make sure you are drying it from front to back. And then after you have dried it completely, then you can position her on her side, and then you can start cleaning the rectal area. So you are just going to get a clean washcloth and then make it a mitten, and then you are just going to wet it in the wash basin and then apply soap. And then when you clean the rectal area, you are going to start from the vagina and then work your way to the anus, because we want to clean from clean to dirty. So after that, you're just going to keep repeating this step until the anus is completely clean. And then after it is clean, you are just going to just get a new washcloth and then just damp it. And then now you are going to rinse it. And then after you have rinsed the anus, you are just going to dry it, and make sure you start from the vagina and then to the anus. And then after that, you are going to remove the waterproof underpad, and then you are going to remove your gloves, wash your hands, put on new clean gloves. And then you are going to provide your patient with clean, non-soiled linen. So just put new linen on your patient's bed. And then you could put the linen up here, and then you could just remove the bath blanket and put the bath blanket in the laundry bag. And then you could position your patient on her back in good alignment, make sure she is comfortable. And then you are going to be putting away and cleaning your supplies. So the waterproof underpad, I would dispose this, as well as my gloves. And then for my wash basin, I would clean this as well as this, and just make sure that they are completely dry. I would dry them with my paper towel. So just make sure that when you put these back, they are completely dry. And then all of my washcloths, they would be in the laundry bag, and my towel and bath towel would also be in the laundry bag. And then once I have put all of my supplies back where they are supposed to go, I would take a clean new paper towel and just clean the overside bed table. And then I would put the overside bed table back in a safe, appropriate spot so no one would trip over it or anything like that. And then I would just make sure, well, then I could remove my gloves, wash my hands, and then I could lower my patient's bed and then make sure that the bed wheels are locked, and then I can unscreen the person, do a safety check around the room, make sure that the call light or anything else is back in my patient's reach, and then I would also report and record my observations to the nurse. And that is how you give female perineal care. Thank you.